Hi, I'm Michaela Roller. I'm a Miles Community College nursing student, and today I'm going to show you how to do insulin injections. So first off, you're going to start with your 6 rights. So right med, right patient, right dose, right route, right time, right documentation. And then you're going to do your hand hygiene, so you're going to go wash your hands and make sure they're all clean. So today, then you're going to check your orders against your MAR, and you're seeing that you have Humulin R, U100 insulin subcutaneous per sliding scale twice daily. So you're gonna have to do your 2. So you're gonna have your short acting and your intermediate acting. So when you mix these 2, you want to go from the short acting into the intermediate acting, because you do not want to get any of the intermediate acting insulin into the short acting insulin if these are multi-use vials. So first you're gonna look. So you're gonna look at both of them. You're gonna make sure you have the right thing. You're going to check expiration dates. You're going to check and see if they've been opened. If they've been opened, the rule is they're good for 30 days usually. So you're going to look and you have what you need, and both are not expired and are good still. So then you're going to check your vials and you're going to make sure that there's no cracks or particulates, and there's not. And so then you are going to first clean off both lids to the vials. So you're going to clean off this one and throw away. You are then going to clean off the other one, and you're going to throw away. So then you will pull back enough air in. I got a new needle actually. So you're going to open a needle, and you're going to pull back enough air for the. So if you're doing the sliding scale, he is at 245 for his glucose. So you're going to look. So he's going to need 10 units on the sliding scale. So you're going to pull back air for 10 units. And you're going to uncap. Leave your cap sitting up, so you can do your capri. So then you're going to go into the intermediate first, inject half of the air. Then you're going to go into your short acting, and you're going to insert the rest of the air. Then you're going to pull back the right medication for your short acting, and make sure there's no bubbles. And then that is when you will then go to pull up your long acting or intermediate acting, and you will pull up the rest, and you want to pull exactly to the number. If you pull past what the dose is, you're going to have to start all over, because then it is mixed. So you don't want it to be mixed, because then you don't have the correct dose that you were that the patient was prescribed. So you want to make sure that when you're pulling back the intermediate, that you pull back directly to the line of what you need, or you start all over. And then you're going to recap your needle with the one-handed recap method. Hold down. So then you have your insulins. With this, you're going to have to check with another nurse to make sure this is the correct dosage. Insulin can be very dangerous, so they have to confirm that it is the correct dose, and then they will have to sign off as well. So you go check it with another nurse, and they say, okay, it's correct. So then you would check it again with your MAR and your doctor's order and make sure you have the correct amount. And you do. So then you're going to go down to your patient's room, and you're going to knock, and you're going to introduce yourself. You're going to ask for 2 identifiers. Make sure you have the right patient, and it is name and date of birth. And then once you have the correct patient, you're going to explain what you're going to do. And then you are going to wash your hands again. And then, so you're washing your hands, and then you're going to get gloves. You're going to put your gloves back on. And then the most common sites for insulin injections are usually either the top of the buttocks, your abdomen, where there's fatty tissue. You want to go right into the adipose tissue when you do it. That's where you want it to be absorbed. Or sometimes people will do it up in the fatty tissue in the upper arm. So you would do the injection. So you have your site. So then you're going to pinch up when you do. So you're going to uncap. Oh, wait. First, you're going to clean with an alcohol wipe, and then you're going to let it dry. You're going to let it air dry. So you're cleaning with it. Then that is when you will uncap your needle. It's dry. You're going to pinch up, and then you are going to go 90 degrees for a person who has a decent amount of adipose tissue. For somebody who does not and is on the skinnier side, you're going to go 45-degree angle. So we're going to go 90-degree angle, and you go in, and then you want to insert slowly. So you're going to slowly insert your insulin into the patient, and then you will release. You will dispose of it into your sharps container, and then you will dab it with a gauze if it's bleeding, and then you will ask the patient how they're doing and how the procedure went. Then you will go and you're going to document what you did. So how the patient reacted to their insulin, when you gave it to them, how much it was, and how it went. All right, thank you.